The greatest concern of workers is that already most of the community that has been in the clinic for the entire week have a chance of also being positive. And as a result, the nurses saw it fit that they need to begin to take a stand and demand that they know their COVID-19 status for their own safety first, but also to ensure that the community of Mofolo is also safe. You'll understand that the positive case that came out from this particular facility was in contact with all, if not majority, including the patients that came to Mofolo in the latter week, and also brought in his family into the facility. And all of them at this present moment is unknown if all of them are even positive. The concern really is clear that the request and the demands of the workers is that they are requesting to be screened and tested. And the results, once they are out, they will be able to resume duties. But whilst they are waiting for results, they've also demanded that Mofolo be deep cleaned, be fumigated, and we know it's safe, not just for working, but also for be used as a safe services for people of Soweto. Because I think the whole notion here is that the lives of Soweto people matter. We cannot be seeing in other provinces, in other regions, when there's incidences such as this one, we find that we are able to indeed fumigate and make sure that it's safe. But when it comes to Soweto, we want to do it in a different way. So that is why the demands stand to say, let's protect our people. Moreover, that the community of Mofolo has got people with comorbids, they've got conditions, diabetes, a lot of them even today, a lot of chronics were here, and they don't know what is, that they are actually putting their lives at risk.
We understand that there were tests that were being carried out in the clinic. You said to me earlier that about 50 people so far were tested. Is the 50 or the positive case that you've identified part of that 50, as well as how were the employees notified about this positive case?
The positive case managed to get their results speedily from outside the facility, which he tested privately. The people that have been tested is after he had divulged that he is positive and informed the rest of the staff that he has, and showed them that he is positive. And that's when the clinic started testing. But they ran out of kits because they said they only had less than 50. And so far today, they were borrowing everywhere. We sat with the matron and the director who were borrowing test kits from everywhere because they didn't have resources. And they could not guarantee that this can actually be fast-tracked. So where we are sitting right now, not all nurses and all healthcare providers have been tested. Hence, we are coming up with a plan of saying, let's take them somewhere where they'll be tested, where we will track the results and make sure that we know what if they're negative or positive, and those who are negative can come to a clean facility and continue working.
I heard earlier a member of the NOSA saying that the testing of healthcare workers, especially here in Soweto, is not made a prioritization. Where do you stand with that?
It is absolutely true. In fact, in our demands that we sent to the president as young nurses in our trade union, the president of the country, demand number one is that testing of healthcare providers should not be compromised. It should be done periodically, as often as we can, because those people, they are the worst if they tend to be carriers. A facility like Mofolo would see easily more than 500 people in a day. So you can imagine if one nurse is able to come in contact and 500 people of this community gets infected, where will that put us as a country? So we cannot risk that.
All right, so you've spoken to the workers here, the healthcare workers here, pleading with them to go get tested at the nearest clinic, which you said was Soweto. Just speak to me more about that, as well as what steps you'll be taking if you are not able to, for instance, get all these tests done within the weekend. Will we see the doors opening anytime soon, or when do you foresee that we'll see the doors of the clinic opening anytime?
As Gauteng, we are confident that we've got a responsive MEC. We believe that an instance such as this one will be able to step up and actually show muscle that he normally shows, that he's responsive. He will come through and make sure that Mofolo is reopened again, but also the demands of the workers are met. Because I do believe they are not asking for anything that is impossible. They are actually asking to save lives of patients.